Hi, I'm Ramsey Hunt Steven. This is my 10-week update with Ramsey Hunt Syndrome. A little preview. I'm going to talk about a new vestibular therapy that I started this week. Talk about my experience with a new doctor. I was able to exercise for the first time since getting diagnosed, and some thoughts on choosing hope and optimism. So the Monday of this week, I started vestibular therapy. One of the things I learned is our balance is determined by three systems. There's the vestibular system, which is determined by the inner ear. And obviously, one of mine isn't working. The nerve is not working. There's the visual system, the eyes that help us know where to be and how to balance. And then this is a fancy word, the proprioceptive system. That's our muscles, tendons, joints, and skin. So I'm down, I guess, half of a system because this one works. But boy, that's a significant impact to balance. And the therapy is focusing on strengthening the other two systems. Let me show you the exercises that I'm doing in this first week. The first vestibular exercise that I am doing is around eye tracking. My therapist gave me these sticky notes, and what I have to do is move my head, and the faster I move it, I'm supposed to keep my eyes on the note. It definitely gets a little bit dizzy when I do this, but this is exercise number 1 that I'm doing. Exercise 2 is going up and down. Again, I'm trying to track. This one's a little bit easier and try and keep my eye on the X. The next exercise, I move the sticky, move my eyes, then I move my head, and then I move the sticky, move my eyes, move my head. Again, more eye tracking. All right, the last exercise I do is standing up. And this is to help my body balance system, the muscular skeletal system. So they have me put my feet together. And then this is really crazy when I did it at therapy. I close my eyes and you can see like I have a hard time balancing. So I do this exercise to try and balance. It's crazy how much just closing my eyes affects my balance. So again, the tracking to help with my eyes and the foot balance to help with my muscular system to offset this broken inner ear. So the hope is by strengthening the other two systems that'll offset the non-functioning system. Hopefully this one comes back online at some point, but if it doesn't, I just have to learn to balance more with my eyes and my body. I also saw my new specialist doctor. I'm seeing many doctors, but the primary doctor for Ramsey Hunt Syndrome is an ear, nose, throat doctor. Now, I talked about this a few weeks ago. My previous ear, nose, throat, who diagnosed me, said he didn't feel like he had enough tools to help me. So he wanted me to go to a more specialized ear, nose, throat doctor. This is a doctor of otolaryngology, ear, nose, throat, and neurotology. These are crazy words. Neurotology is a specialized field within otolaryngology that focuses on disorders of the inner ear, auditory nerve, and the base of the skull. It's essentially the intersection of otology, study of the ear, and neurology, study of the nervous system. Neurotologists are trained in both medical and surgical treatments of these disorders, including hearing loss, balance disorders, tumors, and facial nerve problems. I like the new doctor. He said he has a lot of experience with Ramsey Hunt. We talked about where I've been, status of what's going on, and we're going to start by getting a baseline of what's going on with the nerves. So I'm going to do an MRI, see what's going on in my head, see if there's anything anomalous there, as well as a nerve test to see how functioning or dysfunctioning the nerve is. There are a number of surgical procedures they can do, but that'll probably be down the road, but we're at least going to baseline off of what's working, not working. I feel pretty good about this new doctor. I liked the way he responded to things, the way he's talking about things. It seems like he knows what he's doing. There's still a lot of waiting. I don't think there's a lot of magic, but at least there's some additional tools that he can use. Very exciting to me as I was able to exercise for the first time since getting sick, which has been over 2.5 months. I started by lifting weights. Now, if you see me, you can tell I am not a specimen of muscle and strength. I am an endurance guy, but I do lift weights to build up resilience. And because my balance is off, I decided I would start with some weightlifting. And we'll see here with some recordings. I was able to do almost every exercise I wanted to do. The only one I didn't consciously choose to do was any sort of crunches because of the motion in the head. Most of my exercises are using machines, somewhat static in nature, and I was able to do them all. I have lost a ton of strength, not that I had much to begin with. I've lost a lot of weight since getting sick. I think a lot of it has been muscle mass. So it just felt really good to get back out and do some exercise. And I'm hoping to do more in this following week. Other good news is I was able to settle my stomach. As I noted previously, I was having a lot of stomach issues. It even caused a fall a couple weeks ago. So I got off all the supplements, all the things, and I was able to reset with a heavy dose of cake and ice cream, seeing that there was a lot of birthdays last week, and I haven't got back on them, but I'm ready to. So I'm going to start reintegrating some supplements and just see how my stomach goes. I have no bad news this week. It's always good when I can say that. Status quo, I don't feel like I've had any change in hearing, no change in paralysis. I think my neutral face is a little bit better, but I don't know. Definitely no movement in the eye. My acupuncturist did say, though, he felt like I was able to close my eye. My eye was closing a little bit better. But when I try, as we'll see in the Palsy Check here, I'm not sure. So maybe when I relax, it's better. But when I try, I don't think so. My energy is still kind of low. Although as I'm getting more active, I'm hoping that will lead to more energy. All right, let's do our weekly palsy check and see if we can see any changes. Let's raise the eyebrow, close the eyes, puff the cheeks, smile, whistle. I don't feel like there's been much progress, so let's see how we do in the next week. In terms of learnings and work, one of the things I'm finding as I'm moving on to more and a variety of treatments is it just takes a lot of time. So I actually feel like I'm taking a step back in my ability to work because I'm going to different doctors and different places and having to drive farther to get to those doctors. Right now, it's 3 days a week, but I could see it even expanding far beyond that. And that's kind of hard if you're dealing with medical issues. One of the challenges is time. Emotionally, I'm holding steady. There's a lot going on in life, but I'm hanging in there. Part of the reason I think I'm doing okay emotionally is I think I'm choosing hope. I've had some people tell me that they find these videos inspiring. The main reason I'm doing these videos is for somebody else that might be getting Ramsey Hunt Syndrome and is looking for some insights of somebody else's experiences. At this time when I'm recording them, there's not a lot of people recording their experiences around Ramsey Hunt on YouTube. And so I'm hoping to leave a legacy that can help somebody. But I have had people who don't have Ramsey Hunt syndrome, neighbors and friends and colleagues and former colleagues, tell me that they find these videos inspiring. I like to think I'm a decently optimistic person, and I think my hope is really spiritual in nature. In the book of Romans, now the God of hope fill you with all joy and peace in believing, that you may abound in hope through the power of the Holy Ghost. I've felt really blessed through this experience. It has not only been something where I've learned resilience and had a blessing of hope, but through this experience has unlocked some insights for me that have been really important. For that reason, I can't help but be grateful. Maybe I needed this terrible syndrome to become the person I needed to be. I don't know. But because of the hope and optimism that I felt through the grace of God, I've been able to be open to new levels of understanding of myself and those around me. And that feels really good and it's been much needed. So if my videos are giving you a little bit of hope, then I'm happy because it's not me, it's him. Well, that wraps up this week's update. If you like this stuff, like it, ask me a question in the comments, tell me how I can do better with the videos, and subscribe to the channel so you can be notified when I drop the next video.